You may have heard of swimmer's ear, but do you know exactly what it is or how you can get it? Most people assume you only get it while swimming in the pool, but it turns out that's only one of a handful of places you can develop this. So joining us now is Dr. Rajiv Pandit, an ear, nose, and throat specialist at Methodist Dallas Medical Center, and he's here to offer some tips on how to avoid swimmer's ear and explain what exactly it is. So thank you so much for joining us this afternoon. So as I mentioned before, most people assume you only get swimmer's ear in the pool, but it turns out there are a few other places where you can develop this condition, right?
Sure. Anytime you have a warm, moist environment, you're more susceptible to bacteria settling in your ear. So in the summer, we see an increased risk of outer ear infections, or otherwise known as swimmer's ear. Also in a pond or a lake, or if you scratch your ear, anytime you have water that stays in your ear, you have an increased risk.
Even the bathtub and the shower,
Even the bathtub, yes. And if you're a diabetic or have other medical problems, that also increases the risk.
Wow, that must surprise a lot of people. So you started to explain where exactly this has an effect on you, and we're talking about the ear exactly, but what part?
Yeah, so it's the outer ear, so the ear canal, so everything outside of the eardrum. Ear infections can be very painful. You can have drainage, muffled hearing, and it's a very uncomfortable sensation.
I'm sure it is. I'm wondering if fever, any of that, what some other symptoms may be that people experience with swimmer's ear?
Generally not fever. The most common telling sign is pain and swelling. That throbbing sensation that something isn't right.
So if you have it, what's the best way to treat it?
So if you have an ear infection, you should see a doctor, because most often an outer ear infection or swimmer's ear is a bacterial infection, and you may need antibiotics by mouth, or what's more effective is actually antibiotic ear drops.
Oh wow, so you may start off taking painkillers to help avoid the pain, but then you really need to go see a specialist in that case. After a few days, if you notice the pain isn't going away, that's typically when you should...
Usually in 48 hours.
48 hours, quickly?
Yes.
Okay.
Yes.
So now we know how to get it, how to treat it. Are there any tips to help avoid it?
Yes, so the best way to avoid swimmer's ear is to not go swimming, but that is not a popular choice, especially in the summer.
Exactly.
So another option when you go swimming is to actually turn your head to the side, pull your ear back, and just shake it a little bit, and do that on both sides to get all the remaining water out. Another option, especially for frequent swimmers, is to mix white vinegar and rubbing alcohol, half and half, about 2 or 3 drops in each ear before and after swimming. That prevents ear infections.
Oh wow, cleans it out, I guess.
Yes, and it restores the pH and it kills any bacteria that may be trying to survive in your ear.
And what about earplugs? Do those actually help?
Actually, earplugs don't really, we found they're not effective because they retain moisture in the ear, and that increases the risk of any bacteria that might already be there spreading.
All right. Well, Dr. Pandit, thank you so much for joining us and giving us a lot of tips that I think a lot of people weren't aware about until we had this conversation, so we really appreciate it.
Thank you.